Hello, my name is Paisley Robinson and I'm going to be performing my IV Med Push along with my piggyback. I'm going to make sure that I follow my general principles and safety practices along with my 3 medication checks and my 11 rights of medication. So I would enter my patient's room, perform hand hygiene. I'm going to identify my patient with 2 patient identifiers, comparing the MAR against their wristband. I'm also going to assess them for any kind of allergies. I'm also going to check their wristband. I'm going to be doing a med push of 40 milligrams of Lasix and with a piggyback of cephalexin 1 gram over 30 minutes. And I've also checked all the packaging, made sure all the expirations are good, and I've also made sure that all medications are compatible along with it. So then I'm going to perform hand hygiene. I'm also going to assess the IV site, make sure that there's no redness, the patient's not having any pain. So first I'm going to do my med push of my Lasix, and I already did my first 2 checks at the Pyxis, comparing them against the MAR, and they matched, and I'm going to do my 3rd med check at the bedside. I'm going to clamp this off. I'm going to scrub the hub. And first I'm going to be attaching normal saline. I'm going to pull back, make sure I have blood return, and I do. And then I'm going to slowly push, assessing the site over a duration of a minute, making sure there's no redness, no pain, and there isn't. I'm going to get a new gauze and scrub the hub. Now I'm going to be pushing the medication, and I'm going to be pushing it at the prescribed rate. I'm also assessing the site, making sure the patient's not having any pain, no infiltration, no redness. And then I'm going to scrub the hub. And lastly, I'm going to flush with some normal saline. And I'm going to make sure that I do this over the same duration of the medication. I'm going to remove it. Once I'm done with that, I'm going to scrub the hub. And I'm going to put a Curel's cap over it. Then I'm going to evaluate my patient, make sure that they tolerate the medication appropriately, and then I'm going to immediately document the medication that I just gave. I'm going to remove my gloves, perform hand hygiene, and then I'm going to move on to my piggyback. So I've done hand hygiene. I'm going to put my gloves on. Open my new tubing. Going to remove the cap, get my antibiotic, and making sure not to contaminate, I'm going to spike my bag. And I'm going to hang it. I'm going to fill the chamber halfway. Then I'm going to remove my cap. I'm going to unlock. It was closed, now I'm going to open it, allow it to drain, checking for air bubbles. There's no air bubbles, and I'm priming the line. I'm going to put my cap back on. Then I'm going to drop my primary line down. Then I'm going to get new gauze. I'm going to scrub the hub, or alcohol swab, scrub the hub. Going to attach. And then I'm going to make sure that it is dripping at the appropriate rate. I'm also assessing the patient's IV site, making sure there's no kind of infiltration, no redness, they're not experiencing any pain. I'm going to come back over a duration of time periodically and check on my patient, make sure they're doing okay, and that the site is good. I'm going to immediately document the medication that I gave. I'm going to remove my gloves, perform hand hygiene. So then I would come back, my medication is done. I'm going to perform hand hygiene, put on gloves. I'm going to assess my patient, IV site, make sure that there's no redness, no infiltration, they're not having any issues, and they tolerate the medication good. I'm going to close the clamp, remove my piggyback, dispose of it. I'm going to get a new gauze and scrub the hub. I'm going to put a Kuros cap over it. Then I'm going to hang this back up to make sure that the appropriate rate is dripping. I'm assessing the site, making sure my patient is tolerating it well. There's no redness, no issues. And then I'm going to document what I did, remove my gloves, perform hand hygiene, and then I'm going to come back and reevaluate my patient and make sure that their site's still flowing good and that they're doing good.